Okay, Bismillah ar-Rahman ar-Rahim. Today I'm going to talk to you about an experience that may be useful to many of you, if especially if you have contact with students or with house officers. So I just wanted, out of curiosity, to ask how many of you actually have students or house officers that you teach? Yani, how many of you are okay? Anyways. There was an advertisement for one of the beverages which said اتجنن. اتجنن means be crazy. It's an invitation to be crazy. I believe that the first step in change is that you need to be somehow crazy. You have to think of things in a totally different way. What we did actually in the project called Patient Doctor New Era, it was mainly a student, house officer based initiative. I was just one of the people who were supervising the project. In 2005, they decided that they want to be positive in their community of just one of the doors of the internal medicine hospitals. What I'm trying to do today is I'm just going to give you a briefing about what they did actually in internal medicine hospital, and how we can make use of this in our nephrology department in Qasr Aini and hopefully in other places. First of all, I just want to start with an exercise. I want to split the hall into two parts. Let's say this part is group A. Doctor, you will be okay, as you like. Okay, and this part will be group B. Okay, you are group B. I want group B, please, to look downwards at the floor. I don't want you to see the next slide. Group B, look please at the floor. Dr. May, please don't cheat. Okay. Group A only now is seeing this slide. So group B is not supposed to see anything right now. Okay. I just want you to look at it for a few seconds. Okay. Now, please, everybody look downwards. Everybody look downwards, please. Now, I want group A to keep looking downwards, and I want only group B to look upwards. Group B should be looking at the slide right now. Group B only, okay? Okay, now both groups can please take a look. How many of you, when you look at this slide, you feel that this slide reminds you of youth and young age and hope and things like that? Can you please raise your hands? Okay, something very strange happened. Please keep your hands up. Most of the hands are there, right? It's very strange. Okay? How many of you think that this reminds you of old age, and it's a depressing slide? Okay? Most of the hands are on this side. Okay? This is very, very strange, right? No, it's a geographical issue. Maybe this country is a very depressed country, and this country is a very optimistic country. Actually, this picture has both of these two pictures inside it. This is one of the pictures. It's a picture of an old woman. Only one group saw this picture, the depressed country. Okay, so this picture of an old lady, and the other group saw this picture. It's a picture of a young lady. Okay, only for a few seconds, only for about 10 seconds. What happened when I exposed this picture has both. If you look at this is the nose, this is the ear, this is the eye, this is the hair, the mouth, and the chin. Okay, this is an old lady. At the same time, you can look at it a different way. This is the chin, this is the eye, this is the necklace, and this is the neck. Aha! This exercise, I took it from a very famous book called 7 Habits of Highly Effective People. It's for somebody called Arkovi. Arkovi is a very famous personal development person. And what he called this experience, he called it the aha experience. Because when people suddenly start to see things in a totally different way, and they start to realize that maybe my opinion is wrong. Maybe there's another way to look at things. If I hadn't explained this picture, and I started some sort of a debate between the two groups, probably these people would probably start accusing, you are so depressive. Why are you looking at the world in such a depressive way? Okay, and then if I gave the microphone to the other group, they would probably say, you're dreaming. What are you saying? This is a very old lady. What are you speaking about? This is what the other group will probably say. And this explains why in this world many people sometimes take the lead and say, yes, I'm going to make a change. There is a hope in this world. There is something positive in this world. I'm going to make a change. And it also explains why frequently you find two of your friends, you know that both of them are excellent people. They're friends on Facebook, okay? And you find them attacking each other and fighting and accusing and whatever. And this is part of the explanation, that each and every one of us has a different background. To prove what I'm saying, this exercise has trained every group for only 10 seconds. You had 10 seconds of different past experience, only 10 seconds. And this 10 seconds made a completely different mindset for each group, and they, therefore, each had a totally different way of looking at things. And this is what happens in 10 seconds. What about 10 days? What about 10 years? What about when people have different schools or are raised in different environments? Somebody in a poor environment, someone in a rich environment. What I'm trying to say is a concept called the paradigm shift. Paradigm is how you see things. Actually, how you see things is not necessarily how things are. There are different ways of seeing different things. And what Stephen R. Covey called this phenomenon, this aha experience, he called it the paradigm shift. It's when people from the depressed country start to see both pictures. How many of you now, after I demonstrated, see both pictures? Can you please raise your hands? Yes, okay. So most of the people had the aha experience. They had this paradigm shift. Quickly, in 1 second, please, whoever reads this and has positive experiences, please raise your hand. Read this and say if it's positive. Okay, who thinks it's negative? Who thinks it's negative? Okay? Actually, this reads, opportunity is nowhere. Right? Opportunity is nowhere. It's nowhere. There is no hope. And it also reads, yes, opportunity is now here. Okay? It's totally opposite concept. Okay? Saad Zaghlul is a very famous person in Egyptian history, and he said, "Ma fish fayda." Fish fayda means there is no hope. Forget it. You're not gonna do anything in this. It's hopeless. Okay? There was a book called "لماذا لا يثور المصريون." It was written very, very close to the Egyptian revolution, and it was saying that no, Egyptians will not do it. Opportunity is nowhere. Don't even think about it. We have been oppressed since the pharaohs, and we're not brought up to make revolutions. And this is the difference between Dr. Mona and the unit that was next to her in the same city. Okay, is that Dr. Mona saw that there is opportunity that's now and here, and the others just thought in the usual way. And there's no opportunity, no way, nowhere.
مش لازم تقعد تعكس في منى وخش في الجد. You got 5 more minutes to go.
Okay. our mission in Patient Doctor New Era, the organization that I'm working in, is this: to spread the spirit of medical volunteerism, is to promote. Is to promote. No, no way.
5 minutes.
Okay. To spread this spirit of medical volunteerism and to make people start to think creatively. This is a quick video demonstrating some of our achievements in 2006-2007. The project at that time was at its peak. The total number of volunteers that we had are about 3,750 volunteers. They worked mainly in two big projects. The first project we called Eye on Patient, and it was about teaching young people to be positive in their small environment. House officers in their unit. It was about promoting that they start to educate their own patients, to make rotations on their patients, and later on they started to market. This is one of the marketing campaigns when we started to speak to students. We wanted to make students, since they were very young, start to enter into the hospital and start sharing in our courses and to start to make a change. Later on we developed some more workshops and stuff like that, and these days we started to mobilize some of these volunteers to make some health education activities in our nephrology department. The volunteers who are young aged are usually much more creative. If you notice any child, 5-year-old and 6-year-old, they never draw on paper. They always draw on the wall, because they're not yet limited. They're thinking, they don't believe that you should write on this small piece of paper when you have a very big paper on the wall. So that's what they started to do. Actually, this is one of the health education materials that they developed. They scanned it's a very funny news magazine for diabetes, and they started to take some comic pictures that they developed so that they can teach the patients in a much more interesting way. The other project was an infection control project, which we started by trying to teach nurses. We made some courses for students and for nurses, and the surprise was that the effect was almost zero. After we gave many people so many courses, they didn't develop anything. They just looked at this phosphoric blue substance called sterilium, which they didn't see in reality, and they were just amazed. So we decided to start some other activities like human resource development and tender loving care. Tender loving care is a project in which we started to mobilize students and sometimes even non-medical people to start to visit patients and develop the psychological component related to this person. To start to touch the human aspect of the what we learned from the experience of infection control was that teaching nurses alone was not enough. So we started to focus on motivation, then data collection, then fundraising. These young students that you never expect can do anything managed to get a donation of 1 million Egyptian pounds, and they started to buy gloves and sterilium for the internal medicine hospital. And at the end, we started supervising these nurses to measure the current situation. These are the number of procedures that we observed per week. Total of about 450 volunteers participated in this project. This is the situation before we started in 2007. Hand washing before procedures was about 0%, and glove wearing was about 11%. After the first and third weeks, hand washing improved markedly, glove wearing improved markedly, and we are proud to say that we didn't give any nurse, except maybe one nurse, a punishment, a financial punishment. It was all related to motivation and rewards and stuff like that. quickly, I don't want to bore you. This is the 101st week, and over 2 years, it improved. The situation improved markedly. We started to implement a similar project in Qasr Aini Kidney Center. The blue and red bars are in 2007, and the green bar is in 2012. Of course, after our campaigns, there was a relapse. This is also something that they study in quality and change management, is that after, don't be depressed if after you achieve a big change, the people relapse again. They did relapse after this. This is a fundamental quality process. 85% of the reasons for failure to meet customer expectations, our customer of course is the patient, are related to deficiencies in systems and process rather than the employee. This is the opposite of what we do in Egypt. We keep fighting with the resident and fighting with the nurse and fighting with what he calls badgering individuals to do better. We keep badgering individuals to do better, and actually the problem is in the process. This is a curve demonstrating that. Let's apply this curve to the Egyptian revolution. Things were going very, very badly. We were deteriorating, and suddenly we improved very much. And some people think that we are deteriorating. The same thing you can apply this on anything, on infection control, on developing yourself, on many things. But if you know that what the professionals say, they say that the improvement process works like this. You have something called incremental improvements, which means that you have a small improvement, and then you try something, and then it fails. So you get depressed, and you go and cry a little bit, and then you try something else, and this improves a little bit. If you zoom in too much, okay, you will get depressed. What's happening? After I made a big improvement, it deteriorated again. What happens is that after your trials and after you pray to God, Ya Rabb waffa'ni, and after you make an effort, suddenly something happens. What they call a radical breakthrough. Suddenly, this is what happened with the Egyptian revolution. Many people were trying and failing sometimes and whatever, and suddenly the revolution happened. And after this revolution, it's expected that you will have a decline again and whatever. Actually, the slide I showed you before is this part of the process. This is the slide I just showed you. If you look at this part, you will get depressed. But actually, we are in this part. We had a big revolution in Egypt, and it's improving. There are so many. I met so many young people with so many initiatives before and after the revolution. And after the revolution, the number was multiplied by about 30. There are about 100 new student clubs in our university, and I knew that this is not just our university. It's almost in all universities. There has been a very big breakthrough. That's it, so that Dr. Muhammad doesn't kill me. That's about all I wanted to say. I am very happy that Dr. Mona made this move to I was thinking of doing exactly the same thing.
I'm very happy that you work with us. I'm very happy that you're one of my
I wanted to thank Dr. Muhammad especially for giving me this opportunity and for saying the good words that he said at the beginning.
Thank you very much.
Thank you so much.
Okay.